Did you know anxiety and depression are the two most common mental health issues worldwide? These illnesses affect more than 75 million Americans, causing high levels of emotional pain and dysfunction within families and businesses. Here to discuss these diseases and their treatment options is best-selling author and distinguished physician Dr. Daniel Amen. Dr. Amen is the CEO and medical director of Amen Clinics. He is also a child and adult psychiatrist and world-renowned brain imaging specialist. Thank you for joining me, Dr. Amen.
Thanks for having me.
So, do you find it common that patients suffer from both anxiety and depression at the same time?
Well, to talk about them as separate disorders is sort of silly because they go together 75% of the time. And what we've seen in our brain imaging work is they're clearly not single disorders, that they have multiple types. And when you understand the type, you can target treatment specifically to their individual brain.
So, how does brain imaging then help you better diagnose and treat these disorders?
Well, it just opens up a whole new world of information. So we can personalize the treatment to their individual brain. Giving someone the diagnosis of an anxiety disorder or depression is sort of like giving people the diagnosis of chest pain. Doctors don't give people the diagnosis of chest pain because it's a symptom. There are too many different causes, from pneumonia to having an ulcer to having a heart attack or a heart arrhythmia. And depression and anxiety are the same thing. There are many different causes, so it could be from a head injury or toxic exposure because you're drinking too much or your medication. And the imaging work helps us know, well, what type do you have? So I wrote a book called Healing Anxiety and Depression where I talk about 7 different types. What type do you have? And then you target the treatment individually to their brain rather than thinking one treatment's going to fit everyone.
It makes a lot of sense. Dr. Amen, thank you so much for sharing your expertise with us.
Thank you.